Hello, everyone, and welcome to today's session, Technology and Kidney Care, the role of telemedicine, mobile apps, and artificial intelligence in managing kidney disease. My name is Ryan Woolley, and I'm the Senior Director of Public Education here at the American Kidney Fund, and I'll serve as your moderator for this session. Technology can help make our lives easier and increase access to treatment, but it can also feel overwhelming, especially when it's new. In this session, we'll unpack some of the latest technologies to support your management of kidney disease, including telemedicine, mobile apps, and artificial intelligence. Later in the session, we'll have a Q&A with our panelists, so feel free to drop your questions in the chat at any time, and we'll try our best to get to your question. And before I get started, I just want to give one disclaimer on the information we're sharing about utilizing technology today is not intended to provide medical advice and should not be relied upon as a substitute for professional advice, diagnosis, or treatment from a qualified professional. All information presented here should be used in consultation with a healthcare professional of your choice. And now, let's get started by introducing our panel for this session. First, we have Delphine Tuo joining us today. Dr. Tuo is a professor of medicine, chief of University of California at San Francisco's Division of Nephrology at Zuckerberg San Francisco General Hospital and Trauma Center, and director of the UCSF Center for Innovation and Access and Quality. Her work is focused on the development, implementation, and evaluation of interventions, including those that are technology enabled, that increase patient self-efficacy and self-management of CKD. Dr. Tuo also focuses on health system innovations that translate evidence into practice for low-income populations with CKD, as they are at the greatest risk of associated comorbidity and mortality. Thanks for being here.
Thank you.
And next, I want to welcome Elle Lee. Elle is a Southern California native and former dialysis social worker who provided psychosocial support to patients and caregivers. She is now a licensed clinical social worker and rare kidney disease educator. Diagnosed with IgA nephropathy at 26, Elle has spent more than 16 years navigating the physical, mental, and emotional journey of dialysis, kidney transplant, and acute rejection. Her lived and clinical experiences drive her passion to improve mental health care in kidney disease and empower patients through evidence-based education. Thanks for being here.
Thank you for having me.
And finally, we have Mark Coronel joining the panel. Mark is a nationally recognized author, kidney patient advocate, TEDx speaker, and healthcare consultant. Diagnosed with focal segmental glomerulosclerosis, or FSGS, during a routine physical in his mid-20s, Mark navigated chronic kidney disease, in-center dialysis, and successfully leveraged social media to secure a living kidney transplant, demonstrating the power of personal storytelling and patient advocacy. With a background of implementing digital health solutions in hospitals, Mark helps organizations and patients navigate healthcare technology, leveraging tools to improve care, streamline workflows, and enhance patient outcomes. Thanks for being here, Mark.
Thank you for having me.
All right, I'm really excited. I'm looking forward to this discussion. First, let's bring up Dr. Tuo. I'd like to start by asking you a few questions. Telemedicine has been around for a while and became very important for many people during the pandemic. What are the benefits of telemedicine for patient access to medical care? And are there any instances you recommend telemedicine over a physical appointment and vice versa?
Yeah, thanks so much for the question. And again, thanks for inviting me to be part of this panel. I think the benefits of telemedicine are largely convenience, right? People don't have to leave their work necessarily for a long period of time. You can slot in a telemedicine visit within a break within your work day or your lunch break, if that's available to you and to your provider. I think challenges with travel become less, particularly in rural areas, right? Where the distance between your healthcare provider and you can be quite long. And then childcare. So it can make it a lot easier for adults to participate in a telemedicine visit if they don't have to worry about childcare responsibilities. So I think the great benefit is I think convenience. I will also say on the provider side, it can sometimes be convenient as well. You may not, if I don't work in a rural environment, but individuals who work in rural environments may have to go to multiple different health centers to see different patients. And so that can limit the accessibility on any given day if your provider is not at that facility on that day. And so doing a telemedicine visit is helpful for the provider as well. I think your second question is when I might recommend a telemedicine visit over an in-person visit. And I would say if it's, I might flip that a little bit and say an in-person visit, I would strongly recommend for an initial visit or initial consultation, if you haven't met your provider yet, an in-person discussion and an in-person introduction, I think is best. I think thereafter, if you have any new symptoms or any new signs or anything physically that is bothersome to you, I do think an in-person visit is most helpful because you can have a very solid physical exam. While there are some new technologies that allow for physical exam by distance, I think at this time, and this is my opinion only, at this time, they're not nearly as good as an in-person physical exam. And so I think if there's anything new in terms of new symptoms, I do think an in-person visit is better. I think barring that, I think in telemedicine visits work really well. So it's particularly for discussion of lab results, for discussion, titration of medications, particularly for blood pressure, right? If you're able to take your blood pressure at home or check your glucose at home and share those results with your providers, with your nephrologist or other providers, I think you can do a lot of that via telemedicine and you can titrate medications accordingly. So I would say those are what I would recommend. And I would caveat that by saying, I think there are no policies or no national recommendations about when to use telemedicine versus not, at least in the nephrology space. Though I suspect as we learn more and more and get more and more practice, I think those best practices will come down the pike.
That's great. Thank you for sharing. Um, Many doctors and hospitals use patient portals. Can you talk a little bit about how patients can utilize their patient portal to communicate with their doctor?
Absolutely, yeah. So when I think of telemedicine, I think of video visits or telehealth visits that are synchronous. We can also think about patient portals as telemedicine or telehealth kind of more broadly. And as many of you know, patient portals are provide individuals the ability to get onto their medical record, see results, and communicate with their providers. And so I often encourage my own patients to use the patient portal to send me quick messages, quick updates, right? Particularly, I'll go back to blood pressure as an example. When I ask individuals to check their blood pressures at home as we're titrating their medications to find the right timing, the right fit for them, the right medication that works for you, you need to tell me what your blood pressures are kind of throughout the day, right? And so you can send those to me via a patient portal message, which makes it really nice. So I can review them, look at the times, and then send you back some recommendations as to different dietary changes and different medication changes. So I think communication with your providers through the patient portal works really well. I think any new symptoms or new questions, I think you can also use it for, with again the caveat if there's anything truly concerning or truly new or urgent, you should definitely not use the patient portal for that. It's really meant for non-urgent questions, non-urgent communication.
Great, thank you. Yeah, it's great to have that option to just field some questions between appointments too and get some quick responses.
Absolutely, yeah. And I will say, I haven't really talked so much about patients who are on dialysis, but using the patient portal in between visits or when you might have a new family member or somebody who might be interested in living donation, you can just ask things like, oh, how can I get more information or what kinds of resources might you recommend for my friend or my colleague or my family member? So again, these non-urgent questions can be very helpful because oftentimes we forget, and by we, me as a patient as well, like I may forget to write down questions and bring them to my next visit, whereas at the top of my mind, I can put it into the patient portal right then and there.
Yeah, definitely. Thank you. Your hospital system has a telehealth navigator program to help people learn more about how to navigate telemedicine. Can you share a little bit about that program?
Yeah, thanks for asking. During the COVID-19 or during the throes of the pandemic, I should say, it became very clear that many individuals were not as comfortable with telehealth, and that may mean logging onto the patient portal, looking at their lab results, sending communication to their providers, or comfort with video visits, to be perfectly honest. And so we were able to leverage we have a group of individuals who have been trained on the patient portal and been trained on telehealth video visits. And so we, as providers, any type of provider in our system, can send a referral essentially to the telehealth navigation team. And these folks will reach out to individual patients that have been referred and help them get onto the patient portal, create sort of a login, set up their devices for biometrics as appropriate to make it easy to log on to the patient portal, and will help them set up their device, whether it's a phone or a tablet or their computer, to perform telehealth video visits. And so it's a nice way for providers who identify folks who may have a little bit more challenges to send them a referral so that they have a little bit more hands-on help from the health system, from individuals who have a little bit more time and who have been trained for this. I will say, as providers, we often or I would love to spend some time with my patients, making sure that they get onto the portal and know how to do this, but I just don't have time during my clinical times. So this, as an extension to the clinical team, really helps make these services available to patients.
That's really great. Definitely helps patients feel prepared and just make the whole process smoother. It's a great
Yeah, just an
program.
additional service, I would say, and an important one.
Yeah. Great, thank you. As a reminder to our audience, we'll be taking questions later on in this session. So please type any questions you have in the chat box, and we'll try to get to all of those at the end. And now, Mark, I'll turn it over to you to share about your experience. Could you share about your kidney disease journey and how you're using AI during your doctor's appointments?
Of course, and thank you again for having me. So I was diagnosed with focal segmental glomerulosclerosis, FSGS, in my mid-20s during a routine physical. And that diagnosis eventually led me to chronic kidney disease, in-center dialysis, which I spent 2,250 hours on that chair. 2,000 of those hours I wasn't able to urinate, and ultimately leading to a living kidney transplant. And one thing I learned quickly is that doctor's appointments can feel overwhelming. There's a lot of information, a lot of terminologies, and sometimes big decisions happen in such a short window of time. So for me, AI has become an organizational tool. Now, with permission with my nephrologist, I ask if I can take notes via recording my appointments and using AI to summarize them into clear bullet points, what was discussed with lab trends, medication changes, and next steps. That way, I don't rely on my memory. I can revisit what was said. I can prepare better follow-up questions. It helps me slow the moment down and make sure I truly understand what happens with my body.
That's great. Great use of technology there. So outside of appointments, could you share a little bit about how you use AI maybe to do research or to find those follow-up questions to ask?
Of course. So outside of my visits is where I found it especially useful. When I'm trying to understand something like about my condition, not just kidney disease in general, but my situation, I break my question into four parts: who I am as a patient, what treatment I'm considering, what alternatives there are, and what outcomes matter to me. That's actually a research method called PICO, but for me, it's just a way to stay focused. So instead of searching what's the best treatment for FSGS, I'll search something like I'm an adult patient with FSGS and a transplant history. If I'm considering treatment A, how does it compare to treatment B to preserve long-term kidney function? Now, I'm searching as me. And then I look into the strength of evidence. Was it tested in strong clinical trials? Were there side effects? Did patients report better quality of life? I'm not just looking for numbers. I'm looking for how real people lived on those treatments, because that's what ultimately affects my life. Now, PICO stands for patients, problems, and populations. I for investigation conditions. C for comparison conditions, um, and O for outcomes. So I integrate all of that stuff in my care to making sure that I'm aware fully of what's going on.
That's great. I feel like you're doing a lot to prepare for those visits and really understand all the information there is out there. What for someone that's never done this before, never used AI, what would be some search terms or questions to put in to kind of get started?
So essentially, what I do is I use that PICO method, right? And I'm very, very specific to my diagnosis, my stages, and that specific model. And I start asking it then relevant questions based on what it outputs towards the conversation. So start small, pick one question about your health that genuinely you want clarifying on. Be specific of who you are, mention your condition, mention your stage, mention what outcomes matter to you and what brings, and then bring what you've learned back into your healthcare team. Use it as a guide for conversation, not to replace one. Now, AI can summarize research, but your doctor knows your body, and that combination is powerful, right? The human experience is definitely needed. I need to really speak with my doctor, and this is just again a second opinion or a direction where I can ask better questions in those moments.
Great, great. Thank you. All right. Now let's turn to Elle. I'd like to hear a little bit about how you use technology to manage your kidney disease. So I know you've had some experience using AI and also a mobile app to help you manage your kidney disease. Can you share a little bit about your kidney disease experience and how you utilize technology to help you manage your symptoms?
Yes, I'd be happy to, and thank you again for having me here. I've been living with a rare kidney disease called IgA nephropathy since my early 20s. And over that time, I've experienced dialysis, a kidney transplant, and rejection. And like Mark mentioned, kidney disease comes with a huge amount of information to manage. So it's medications, symptoms, labs, appointments, and the day-to-day ups and downs that happen in between visits. And so, because I was trying to keep track of different symptoms and medication changes, it led me to start using tools like the Folia mobile app. And Folia is an app designed for people living with chronic and rare diseases to track symptoms, medications, and daily health patterns. The app has been helpful to help me capture what's happening between medical appointments, and because most of our health experiences happen outside of the clinic. And so one way that I've used the app is to track how my body responds to medication change. So whenever my doctor adjusts a medication dose or start a new medication, I can log that change into that app and track the symptoms over the next few weeks. So let's say that I had a medication change yesterday. I can record that change and log the symptoms that I may be experiencing, whether that's like sleep quality, fatigue, swelling, or headaches each day. And it takes only a minute or two to log in that data. And then after a couple of weeks, the app starts to show patterns. So I might notice that fatigue increased after the medication change, or that sleep quality declined during the same period. And so when I go to my next appointment, instead of trying to remember how I felt the last month, I can point to actually what happened during the 2 weeks of the medication adjustment. And that just makes the conversation with my doctor more productive because we're not guessing and we're actually looking at trends and deciding together whether the medication is working well, if it needs an adjustment, or perhaps the symptoms may be coming from something else.
Great. That sounds like such a useful tool. Even better than just writing things down. It's tracking it with the time of day, and you're able to put your medications in. So, thanks for sharing. Could you talk a little bit about how you've collaborated with your care team? So you've brought the information from the app in, and what has that conversation been like?
Yeah, I think many patients can relate walking into an appointment with a list of questions in your head and then walking out realizing you forgot half of them. And so there's a lot to cover in a short amount of time, and it's easy to forget details once you're sitting there trying to explain how you're feeling. So the mobile app is really helpful for using tools like a symptom tracker or even a simple note feature in the help apps that help me to organize those thoughts ahead of time. So, for instance, if something comes up during the week, maybe I'm feeling more fatigue or I'm noticing swelling, I can log it, make a quick note, and then when I go into my appointment, I'm not trying to remember everything from memory. I have a record of what's happening. And instead of saying something general like, I haven't been feeling great, I can point to something specific or patterns that I notice. And so that just helps my care team and me use the appointment more effectively.
That's great. Thank you. Do you have any tips you could share for people who might be interested in getting started with a mobile app like this for managing their kidney care?
Yeah, I think for anyone thinking about trying a health tracking app, my biggest advice is to keep it simple. So you don't have to track everything. In fact, that's usually what makes people stop using it when you're trying to track everything at once. So I would start with one or two things that you're already paying attention to. So, for example, if you're starting a new medication, you might track how you're feeling for the first couple of weeks. Or let's say fatigue is something you're struggling with. You might make a quick note on the day that it feels worse. So it doesn't have to be every day. It doesn't have to be detailed. The goal is just to capture a few things while they're happening so that you're not trying to remember everything weeks later. Even a few notes can help you connect the dots when you're thinking about how a medication or a change in treatment has affected you.
That's great. Thank you, El. All right, now I'd like to bring all of our panelists back onto the screen and open it up for some questions from the audience. All right, and just a reminder for everyone, if you're just joining us, please type any questions you have into the chat and we'll try to get to all of them in this session here. But first, to get us started, Dr. Tuo, given how much technology has changed in the last few years, how do you talk to your patients about using technology such as mobile apps or AI as part of their toolkit for managing kidney disease?
Yeah, I think technology changes every week, right? So I think it's a question of, as both Mark and Elle mentioned, it's a question of using technology to help with something. And that something is, what are we having challenges with as a patient provider sort of duo, right? Or as a patient provider team. And is that keeping track of medications and taking them? So thinking about, oh, let's find something, let's find a technology enabled app to help you remember when to take your medicines, right? Especially if we're changing times, for example, to try to see if we can optimize how you feel during the day. Maybe the issue is actually with diet. Maybe you're unsure about what to eat, or we're having problems with potassium, with high potassium levels. So then maybe an app like a diet tracker app might be helpful to better understand what you're eating during the day so that we can identify where to change. Or maybe it's just not remembering what we're talking about during the visit, as Mark mentioned earlier, using AI to sort of help summarize our conversation so that you can go back to it in between our visits, talk with your family and talk with your friends, and then come back with more questions. So I think it's just instead of thinking of technology as as a fix all, let's think about it as what are the problems we're trying to solve together, or we're trying to navigate, and what technology can help bridge that gap, if you will. And those change all the time. And I will say, I am actually not a huge technology expert. I like to use it, but I find that patients come to me and they're like, hey, I found this great app, and then I can recommend it to others as well. So I would bring these up as a way to help with self-management.
Great, thank you. And Mark, this next question is for you. Are there specific platforms you sign into to get the information you're talking about, and any additional resources you can share?
I use several different platforms essentially, and I never use it. I never use AI in isolation. For me, it serves as a structural second perspective, not a replacing my doctors, but a way to prepare for conversation. If AI summarizes two treatment paths with different risk profiles, I bring that to my nephrology and say, can we talk about this? And how does it apply to me? So it elevates the conversation instead of feeling uh, intimidated or unsure. I walk in prepared and as someone who has been through dialysis and transplant, that confidence changes everything. Uh, I'm not challenging the doctors. I think they know their things, and I think collaboration is key when it comes to using these AI platforms.
Great, thank you. I'll pass this next one to you. Do you have any tips for the audience on, you kind of touched on this a little bit, but just how to stay consistent with tracking things in your mobile app? Do you have reminders that pop up or things like that?
Yeah, to help stay consistent and what's worked better for me is tying it to something that I'm already doing. So, for example, if I'm taking my medications in the morning, that might be a moment I quickly log in how I'm feeling for the day, and it takes another minute. I mean, it takes a minute to do that. Another thing is also giving yourself permission to not do it perfectly. So, like some weeks you'll remember, some weeks you won't, and that's normal. But even logging things occasionally can be helpful because it gives a few reference points instead of relying completely on memory weeks later.
Great, thank you. And Mark, someone from the audience asked if you could repeat the PICO method again and maybe just explain what the acronyms are.
Sure. So PICO is patients, problems, or population. I is for investigation conditions like intervention, exposure risk, prognostic factors, and or test results. C is comparison conditions, intervention, exposure risk, again, prognosis factors or test results prospectively. And O is outcomes.
Great, thank you.
And so can I actually ask, so Mark, when you use that PICO algorithm, when you're in the AI platform, I think you mentioned this a little bit earlier, you provide some information about you, the patient, right? I am an
Right.
adult with so-and-so. This is the comparison or the I is for investigation. So I'm looking for a treatment recommendation, or how do
Yes,
you
so
formulate
essentially
your
I'm using it as
question?
both as a comparison and giving it my specific diagnosis and treatment options that were given to me, which will then go into different questions that then I can ask you guys as nephrologists, look, this is what the research was showing. What do you think about using that with my treatments? And again, as a transplant patient now, I am still going into my within my team every 3 months just to make sure that if that treatment option were to be an option, let's look at lab results doing that specific method and then come back with another follow-up if that doesn't work.
That's great. Yeah. So you can use this not only to identify sort of new treatment options, right, that you might read about, like what are the risks and benefits associated with this treatment option for somebody like me who has had a transplant and has done well for X number of years, or
Correct.
who had a rejection a couple years ago, and then you can
Correct.
bring that to
Correct.
your doctor for further conversation.
And I
That's
also
pretty
want to
awesome.
emphasize, yeah, of course. And I also want to emphasize that it's on a case by case basis, right? This is not general. This is specific to my care. And I know that it's on a case by case basis. What might work for me might not work for somebody else. So I have to be very, very mindful when I do ask those questions as not a general, but more specific to my diagnosis and my rare disease.
And then can I ask one follow-up question?
Of
Sorry. I'm
course.
fascinated by how we use AI to further these conversations. When the AI spits out a response for you or some risks and benefits, do you ever have a second prompt, or do you like further push the AI to give you more thoughts?
I have it actually go into more deeper searches. So what I do is with follow-up questions, I say go into a deeper search about this diagnosis and give me more opinions where relevant questions would start popping up and I start using the ones that I utilize to then talk to my doctor about that specific treatment.
Very cool. Thank you for sharing.
Of course.
And Mark, follow up for you. How has the conversation been with your doctor, your healthcare team? You know, that you're, I was presumably coming with all this knowledge. I'm curious what the reaction is or how that conversation might go.
I tend to ask a lot of questions. I love to know myself and my body and the way it reacts to certain things, the medications I've been on. So currently now I'm on what, 15 medications a day, 105 a week, 420 a month, 5,040 pills a year, just so that my kidneys don't reject, right? So it's a lot of back and forth. Well, my tacro levels are X, Y, and Z. Why is this happening? So the questions don't stop coming, but I also want to make sure that when they do come, it's a team effort.
It's great. Yeah, it's important to be so aware of all the, your own personal health and be able to speak with it and get those questions answered.
100%.
Dr. Chuo, I'm curious from your perspective if you've had patients come to you like, I've done all this research, this is what I found. Like, what's that conversation been like from your perspective?
Yeah, I think it's great. I think it's great for a multitude of reasons. One, because that does mean that patients are are trying to take control of their own health, right? And it is a partnership, so it becomes a more equal partnership between the patient and the provider, which I really appreciate. I also think it's helpful when this information is brought because the AI in general gives you a sense of what the literature shows, and those usually on average, right? It's like for the average adult male, these are the risks and benefits that we may see, right? And that may be a little bit more finely tuned if you might say, oh, but I had a rejection a few months ago, or I had this side effect. And so the results from the AI may change a little bit. But again, it's essentially on average. And so that's why it's really helpful to bring this and say, hey, what do we think together about these risks or these side effects based off of your personal history? And I think the physician team or the provider team can look at your history and say, oh, yeah, we tried a similar medication 2 years ago. It's not called the same, but it's a similar class. It didn't work very well for X reasons. Should we try again with this newer one, or should we try a different? And so I think the nuances of everybody's personal history and personal body, I think, is very important to keep in mind as we're trying to apply this information that comes to us from AI or from various apps.
Yeah, yeah, thank you. Elle, kind of similar question for you. When do you bring your, I guess, how do you talk to your doctor about the information on your app? Do you like show the app to them? Are they able to see that information on the back end, or how does that work?
Yeah, the app is really great because you could bring that data. So, for instance, the Folia app, it'll give you graphs and trends that you can show your doctor to say, hey, this is what's been happening in the last couple of weeks, or since this changed, this is what happened. What's nice about the app too is that not only does it track symptoms, but it can also track, like, let's say your mental health. This day I was experiencing more anxiety or more stress. How does this relate to the medication? Does it have an effect on this? So it's really great. When I'm talking with my doctor, I can bring in that data and just show them on the app, and that we're able to collaborate on that.
And Elle, I wonder, you've been talking about using it a lot for symptoms after medication changes, which makes complete sense. Have you ever used it or seen or chatted with folks to use something similar about behaviors? Like let's say you started to walk 3 times a week, for better exercise and to get out and see how that might affect some of your sleep quality or your fatigue.
Yeah, so for specifically for Folia, you can track all that. So you could set specific goals or symptoms that you want to pay closer attention to and see if it makes a difference with, let's say, your energy level. Let's say you start walking more. Let's say that you're managing diet changes. Does your blood pressure change? So it's just very helpful. There's multiple tools within that app that can be tailored to what the each patient is wanting to do.
That's awesome because I think, well, medications are often what we think about and is a reality for everybody. I love the idea of trying to look at how you feel and your symptoms based on some behaviors, which we know are equally important, I think, for
Yeah,
health.
and it's just been really cool since I started using the app because some days, like some weeks when I am having insomnia or trouble sleeping, then it totally affects other things. And so I can pinpoint that to, like, oh, maybe because I've been having poor sleep, it's about that and not so much about medication or other things that I think may be happening.
Great, thank you. This next question is for you, Dr. Tuo. How can AI tools help identify patterns or trends in patient health data that may otherwise be missed?
Yeah, that's a good question. There are some new tools that I will say I myself have not used yet, so I will have that caveat, but that can look in a patient's chart, right, overlying the electronic health record, and can identify, say, trends in blood pressure changes that we put in the chart or that somebody will put into the patient portal, and can identify those trends based on other aspects within within the health record. So, for example, if I mention I'd like to see changes in blood pressure trends based off of their transplant medications that we're using, right? And we can maybe see that as I went up on a tacrolimus dose, maybe their blood pressure went up a little bit ever so slightly that I might not recognize in 1 or 2 visits, but you can maybe see a trend over time. So I think that technology can be really helpful and to identify small trends that might not be completely obvious in a clinic visit or 1 or 2 clinic visits, but over time. I think symptoms can also be really helpful. We can, especially as we're diagnosing new diseases in somebody who may have FSGS or may have IgA or even other rare diseases, and trying to put everyone's symptoms together. We might say, look back in the electronic medical record, and has this individual ever had a problem with hearing or ever had a problem with joint pains? And maybe it didn't come up in my visit with a patient, but maybe it came up in their primary care visit many years ago where they were complaining of joint pains. And so that's something that I can then pull out of the medical record and ask the patient and say, hey, I noticed a few years ago, or AI noticed a few years ago that you had some joint pains. Are you still having those today? I wonder if that's related to some of your other symptoms that you're telling me today, and that can help pinpoint other diagnoses. So I do think there's a lot coming that can be helpful to summarize symptoms and data that might not always be perfectly available to me at the very moment when I'm in a conversation with a patient.
Great, thank you. Mark, I have a question for you in the chat. How do you deal with any privacy issues related to putting information into AI?
Good question. I don't put my first last name. I don't put any of that stuff. I just really just write it out with the lab results without mentioning my name or anything that can jeopardize like my social security card or anything like that. I really keep it specific without mentioning a name or address or anything like that.
Great, thank you. All right, those are all the questions we have. So thank you all so much for this interesting, engaging discussion on technology. And thank you to our audience for being here, for asking these great questions. Before we close out, I do want to go around the panel here and ask each of you to share one thing you'd like our audience to know and one thing you'd like our audience to do based on today's session. So Dr. Tu, I'll start with you.
So one thing to know, I will say I think lots of providers, me included, don't have a full sense of all the technology that's available, and may not know and may not be able to give a formed opinion on one app versus another tool. So just keep that in mind, right? We are experts in the medicine, not in the technology necessarily. So keep that in mind as you're coming to us with trends and with questions about technologies. But one thing I do encourage is to try a technology, whether it's an AI, whether it's an app that is recommended to you by a friend, by a colleague, by a support group, by somebody with a different condition that has found it helpful for their symptoms or their tracking of medications, and bring it to your doctor. Just try to use one. And I would say go for it and see what happens, and be willing to change. If it doesn't work for you, there are plenty of other apps out there that might be easier for you to use.
Mm.
That's great. Thank you. Ella, let's go to you. What would be one thing you want our audience to know and one thing that you'd like them to do based on this discussion?
Like what Mark and Dr. Trot said earlier, is that technology doesn't replace medical advice or your conversations with your doctor. It is a substitute, it's a supplement. And so the analogy I like to use is like you have a house and you want to make renovations, and it's very hard to do it without tools. But if you have access to a hammer, if you have access to nails, it just makes the renovation a lot easier. And that's how I see technology as a patient, and how I leverage that to help. So always like just what I want the audience to know is just keep that in mind. It's a supplement. It can make things easier for you, and not to replace medical advice or help. And what I would encourage the audience to do is what Dr. Trot said, is like try a piece of technology. I know it can be intimidating if you don't have experience or you haven't done it at all, but really as kidney patients, we already have so much to manage. It's not just our health issues, we got a life outside of our health. So using a piece of technology can just really make things easier for us. And that's what I would encourage people to do. Try something small and try one thing and stick with it so you don't get overwhelmed.
Great, thank you. I like the analogy that you shared. And finally, Mark, what's one thing you'd like our audience to know and one thing you'd like them to do based on our session today?
Of course. So one thing I want you to know is that technology can help you feel less powerless in a system that often feels overwhelming. And one thing I want you to do is try, but try thoughtfully. Before your next appointment, write down one clear question about your care. Explore it carefully using AI, then bring the question into the room with your doctor there ready to help you navigate this illness that's within your body. Um, that simple shift from passive to prepare can completely change how you're experiencing your healthcare journey.
I love
Great.
that. And can I add one more thing I forgot? If you
Absolutely.
haven't signed up for your patient portal, please, please do so. And if you don't know how, ask at your
Right.
next visit. In addition to being prepared with a question, ask who can help me sign up to my patient portal.
Yeah,
Yeah,
absolutely.
that, Dr. Truck, because I just want to add to that, that as a patient, the patient portal is life-changing. It gives us so much access, not just to our labs or our information, but to the doctors. And I find that doctors are responsive, they are in touch, and, for non-medical emergencies, that's just the quickest way to get a hold of your doctor.
Thank you all for sharing and thank you for this great discussion. Thanks for the audience for joining us today. Up next is our latest advances in managing glomerular kidney disease session, which is at 1 p.m. Eastern Time. During this session, you'll learn about the latest advances in research and therapies for people living with kidney conditions. And as we wrap up this session, you'll see a brief survey pop up. So please take a minute to fill it out and tell us how we did. Love to hear your feedback as we plan for future sessions. Thank you, everyone. We'll see you on the next session at 1 p.m. Eastern Time.